Welcome back to another YouTube video, and I'm going to talk to the new employees on the dental team. I'm also going to talk to the doctors and people watching this about your new employees on the dental team. And I'm specifically going to talk about dental terminology. So what I want to discuss or talk about when it comes to new employees on your team is it is like working in a place where they speak another language. Now think about it. I know you've probably been in dentistry for a while, or if you're new, you're thinking, yeah, Laura, you get it, right? Think about the things we say and what we talk about. Like we talk English, right? We're speaking in general, regular terms, but we throw in things like, make sure they get in for their endo. And we want to do a prophylaxis on them. And it's an MODB filling. And they've got MetLife. They're in network. They're out of network. And it's a DO. And then we need to do the the post and core. And then they've got an implant. And then we need to do the abutment. And then, okay, for you new people, you're probably thinking, see, I don't know what she's talking about. For the experienced people watching this, you're like, yeah, so that doesn't make any sense to a new person. Talking about the terms that we use in the dental office is hard, and it's a lot. I remember when I got to dentistry, I didn't know anything about dentistry, and I remember still people would draw root canals for me in a crown, and what's a crown, what's a core buildup, what's an onlay, what's an inlay, what's a filling, what's a 3-surface filling, what's a 1-surface filling. There's a lot of stuff to learn, and we tend to take our employees and throw them to the wolves, expecting them to understand this. So I think going over basic dental terminology is important. I think that we do it on Front Office Rocks. We have basic dental terminology videos that break down, here's all the things that have to do with the cleaning. You can do an exam, you can do a cleaning, you can do, x-rays, and this is the things we do oral home care. Like, what are these terms we're using? Then we get into the preventative or to the restorative, and these are fillings, and this is a amalgam filling versus a resin filling, and this is what an onlay is, and this is what a crown is, and this is when the patient needs a core and crown versus a root canal and a crown, and do all patients who need a crown need a root canal? And there's all these questions that new employees don't know to ask because this is something brand new to them, and every dental office is different. So make sure you're taking time to work with your new employees on basic dental terminology. Don't throw them everything at once. It's going to take time, but make sure they understand what they're talking about over time so that they can feel more confident and grow with their ability to talk to patients. Now, on the flip side, new employees, it's okay to not know. Let me just tell you, it's okay. I didn't know, and I'm still learning, right? I'm still hearing things, and our industry is, improving, and the dentistry we're doing, so you're always going to be learning. So I want you to take a step back and give yourself a little bit of a break if you think you need to know everything right away. You don't need to, okay? Now, you should start learning the basics. Again, at Front Office Rocks, we have the basic terminology. You should know what your doctor does, the types of procedures your doctor does, when you refer out, who do you refer out to. Those are the things you're going to learn over time. But give yourself a break if you don't know, okay? My next thing about basic terminology is sometimes we use clinical terms in the dental office, and the patients use layman terms, right? So it's a root canal, we call it endodontics or an endo. We call it a crown, they call it a cap. Like, there's different things. And as a new employee, you start to get concerned you're not using the right terminology. That's okay. It's okay. Because honestly, the patients don't know what we're saying. The patients don't know what a prophylaxis is. I mean, think about it, right? The patients don't know an FMX. They don't know bite wings. They don't know gutta percha. It's okay that you don't either. Find out what the layman's meaning is. What is this? What is a filling? What is a resin filling versus amalgam? Because you're actually going to be more able to communicate with the patients than some of us who've been in the industry a lot longer, because you are breaking it down to layman's terms. And that's a skill. That's a thing to do, because many times our doctors talk up here and the patients are here when it comes to dental terms, and we can be the liaison between the patient and the doctor. So give yourself a break. Start learning. We have a breakdown at Front Office Rocks where we go over every type of dental procedure. We tell you kind of what the groups are. There's not that many when you actually go through it. Your doctor doesn't do every procedure that's out there. You're going to start to learn what's most done in your practice. but mostly give yourself a break if you're stressed about it, because you'll learn. Trust me, you'll learn. The seasoned people, employees, doctors, take the time or use front office rocks or find a way to help your employees learn. Don't just assume, even if they've worked in dental before, they've never worked in your office. And every dentist is different and how you do things is different. So sit down with your employees and go over the basic things you do in the office. Explain to them like you would a patient, what is an onlay and how does the process go and how do you do endo and why do you do endo, and spend the time teaching them so that they can feel more knowledgeable and be more effective when they're talking to patients. And then use things like front office rocks to help with that, because we don't have to know it all at once. We don't have to know it all up front, but over time, we should be getting better when it comes to talking about dental, and it will happen, okay? So that's kind of my overview of basic dental terminology. I'm not gonna go through every procedure on here. This is a YouTube video, it's free, there's a thought about it, that's my 2 cents. But come to Front Office Rocks. We can take a brand new employee with no dental experience and teach them everything they need to know about, working up front when it comes to dental, if they're a new dental assistant or floater and they need to know basics of that. If they want to learn insurance is its own language altogether. We are here to help you. So give yourself a break. Seasoned people, doctors, help these employees learn and understand it's okay to talk in layman's terms, because your patients actually understand you probably better than they understand those who've been in the industry a lot longer. So thanks guys for listening. Please write any comments below, questions, reach out to us at Front Office Rocks if you need help. And on that note, I will see you next time.